In the last video, we talked about why dark spots persist and why aggressive treatment often backfires. So today, we are going to break down the different types of hyperpigmentation, why some fade easily, why others stubbornly return, and why misclassification is often the reason why treatment actually fails. So if you've been frustrated with fading products, this video is definitely for you to give you clarity. So many people group all pigment together, and that's why results can be so inconsistent. Fading isn't just about using the strongest product, it's about matching the biology of the pigment with the right approach. So let's break it down. So we have post-inflammatory hyperpigmentation, or what we refer to as PIH. This is pigment that appears after inflammation. So think acne, think irritation or procedures. So it's caused by signals from the skin's immune response that activate melanocytes to produce melanin. So you'll often see PIH around the areas where acne forms. So either your forehead, your chin, your cheeks, your jawline. So how long the pigment sticks around depends on two main things. One is how deep the pigment is and how often the skin experiences triggers. So here's the key. PIH can fade when inflammation is controlled. But if the melanocytes remain primed, even small triggers like a minor breakout, friction, or sun exposure can reactivate the pigment. So that's why targeting pigment alone without calming the underlying inflammatory memory often leads to relapse. Then number two, we have post-inflammatory erythema, PIH. So these are red or pink marks that appear after inflammation. So unlike PIH, PIE isn't actually considered hyperpigmentation. Why? Because it isn't caused by melanin. It's a vascular response. So you'll see it after inflamed acne lesions or procedures have been done like laser. So the good news with PIE, it tends to fade naturally over weeks. So aggressive pigment fading treatments won't speed up the process. So in fact, it will actually lead to irritation of the skin further. So understanding whether a mark is pigment or vascular is very critical. So treating the wrong type of mark is a common reason why treatment actually fails. Then number three, we have melasma. So this is one of the most misunderstood types of hyperpigmentation. Melasma typically presents in symmetrical patterns. So most commonly, it will present across the cheek, across the forehead, your upper lip, and for some people around the chin area. So it doesn't present by itself as a single spot or an isolated spot. Unlike PIH, which follows areas of inflammation, melasma is influenced by a combination of hormonal signals, genetic predisposition, UV exposure, sometimes vascular or inflammatory pathways. So biologically, melasma is complex because pigment is often located at different depths of the skin. So some melanin sit in the superficial layer of the skin, while some can extend deeper. And this is the reason why melasma always responds unevenly to treatment. So patients may notice certain areas lighten while others remain stubborn. Melasma behaves less like a temporary mark and more like a chronic pigment pattern. And that requires long-term regulation rather than short-term fading. So another important characteristic of melasma is its sensitivity to triggers. Sun exposure is one of the major ones, but heat, hormonal shifts, and even aggressive skincare can reactivate melanocytes. So now let's talk about age spots, or what we also refer to as sunspots. So these are entirely separate from PIH or melasma. They appear on sun exposed areas. So you see it mostly on your face, hands, or on your neck or chest, upper chest. And they're triggered by chronic UV exposure and not necessarily inflammation. So melanocytes in these areas have been repeatedly activated over time, which is why pigment fades slowly without intervention. And if sun protection isn't consistent, it can easily come back. So, managing age spots requires a combination of topical fading agents, procedure treatments, and strict sun protection. So, finally, let's talk about why some marks fade quickly and why others persist. Because pigment is depth dependent. So shallow pigment, maybe in the basal layer of the epidermis, is easier to treat and tends to fade faster. But pigment that has been deposited deeper in the skin or pushed deeper by repeated inflammation or UV exposure is slower to fade and harder to reach with treatment. So several factors influence the action depth of pigment, and this can be genetics, which can determine the baseline location and activity of your melanocytes. Then you have skin type. So if you are higher up in the Fitzpatrick type, then often have more active melanocytes. Why? Your melanocytes tend to be much larger, so easier to actually trigger, which can contribute to deeper pigment. And repeated triggers like inflammation or UV can push pigment deeper over time. So, understanding pigment depth is critical for setting realistic expectations and choosing the right treatment approach for your hyperpigmentation. So, what are we saying? Hyperpigmentation is not a one size fits all. So, whether post inflammatory hyperpigmentation, post inflammatory erythema, melasma, or sunspots all behave differently. The depth of pigment and the triggers that activate this influence how quickly your hyperpigmentation fades. So, in the next video, we'll explore why hyperpigmentation keeps coming back, including common triggers, timing, why fading doesn't always mean resolution. So, if you found this helpful, ensure you like, subscribe, and comment down below.